Yeah, I think that's a great segue to another point I wanted to bring up. Now, I don't want this to be one of those articles where it's like millennials kill the economy or baby boomers kill the economy. Like, I hate all that whole pitting generations against each other. But in your experience, again, everybody's different. What are some generalities you see between baby boomers, Gen X, millennials, whatever it may be, and how they, like, what are their mental health general issues? How do they approach it? Are they more open or less open depending on the age? Like, we can start with baby boomers and kind of work our way down. But, when you see these people that are like, let's say 55 and over in 2023, what are some mental health things that you see manifest frequently?
Well, I will say there's more resistance to being open. So building that rapport and building their trust takes a lot more work. But it's because, they were always told that's your business. You don't share your business with other people. You just deal with it or you just stuff it down. And so like having to rewire their brain to be like, it's okay. You can trust certain people with this. They can't blab it out. Like they're confidential. There's confidentiality laws here. And so it's really hard to build the rapport. But once you do, it's like amazing because it's it's this amazing experience of like hearing what they've experienced, all the times in their lives where they're like, man, I wish I had had therapy then because I'm sure this wouldn't have happened later. And I'm like, yeah, but like we're here now, so like we got to work up now.
I would agree. When you look at, the manifestation of mental health, it doesn't see any age differences. Mental health happens. It can increase as we get older just because we're dealing with more like loss, more changes, more medical issues. And that's needless to say, like, could it have been there before or later? I mean, that's a whole other debate, but the issues are all the same. The manifestations can be different across the lifespan for everyone, but no two people look alike regardless of age. When you're dealing with that. And in addition, I think adding to what Elena already said is, the educational piece. Mental health was a more taboo with Generation X and the baby boomers than it is now. It's very much talked about. The kids know it, especially our high school kids. They talk about their therapist. So who is your therapist? How often do you go? They are just more educated, more open that it's okay not to be okay.
It's part of life. It's like you go to soccer practice, you go to therapy. Yeah. But also we have to remember the baby boomers experienced institutionalization, right? Where like if you even had like a minute amount of mental health issues, they're going to send you away to this place where you live forever. And these young kids have no idea what that is. Yeah.
It's something I never would have thought of now that you brought it up. I obviously knew institutionalization existed and it was a thing, but you never would think, oh, I literally have to hide my mental health issues because I literally might get thrown away and they're going to lock away the key. And I always thought, it was more of a generational thing where it was just push it down, deal with it, work hard. It's kind of that cliche baby boomer ethos. I never would have thought that you're literally protecting yourself from being basically thrown in jail. It's a crazy thought to think of.
Yeah.
It's like, no wonder they don't want to open up.
Right, because that's what their fear is. Like, I'm going to tell you this, and then you're going to send me to the crazy house. And it's like, those don't even exist anymore.